I'm Jay Sanders. I'm President Emeritus of the American Telemedicine Association. I'm also CEO of a small consulting firm called the Global Telemedicine Group, and I'm Professor of Medicine at Johns Hopkins. And today, science fiction has really become science, and as melodramatic as this may sound, the fundamental reality is that broadband is really the umbilical cord for healthcare delivery in this country. Fundamentally, in rural communities, as a classic example where we began, the reality is that it is a matter of life and death. What a lot of people also forget is it's not just a matter of life and death for the individual, it's a matter of figuratively life and death of that rural hospital. Because when that individual has to be transferred, that bed census of that hospital goes down, and many rural hospitals are going under because their bed census is going down because of the lack of availability of subspecialists. So fundamentally what telemedicine does is increase the bed census of the rural hospital and sustains it. In a rural community, the number one or the number two employer in town is that rural hospital. So when that rural hospital goes under, the socioeconomic fabric of that community goes under within a 3 to 5 year period of time. So it sustains the life of the individual, literally. It sustains the life of the hospital and the community, figuratively. It also dramatically reduces costs. And one thing that is never commented on, but is perhaps to me one of the biggest strengths of telemedicine and the availability of broadband, is the fact that it significantly increases the educational level, or at the very least sustains the educational level of the rural hospital physician. So actually over a period of time, you see the individual asking for fewer and fewer consultative inputs because they now are up at the level of the consultant. You know, we often talk about rural America and how all of these applications are appropriate for them, because the picture in your mind is, yes, rural, there's geographic isolation, but we all too often forget about the socioeconomic isolation in the inner city. And many people in an inner city have as much difficulty physically getting to a physician as people in rural communities. We need to begin to do a better job in terms of not talking about broadband, but talking about what broadband can provide them, and then you will see the groundswell of activity built up. And one of the most fundamental technologies that have shown dramatic results in terms of reducing rehospitalization for patients with chronic illness is the use of telemedicine. The VA recently, using their broadband network, taking care of 33,000 patients, demonstrated a 30% reduction in rehospitalization, while the quality of care increased. That is our objective, increasing the quality of care, improving access, and decreasing the cost of care. All of this is totally dependent upon that umbilical cord that I opened with, called broadband. Thank you.